Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
Disclosures for this podcast are listed in the podcast page. Welcome to Oncology, Etc., an ASCO Education podcast. I'm Pat Loehrer, Director of Global Oncology and Health Equity at Indiana University.
And I'm Dave Johnson, a medical oncology at the University of Texas Southwestern in Dallas, Texas. If you're a regular listener to our podcast, welcome back. If you're new to Oncology, Etc., the purpose of our podcast is to introduce listeners to interesting and inspirational people and topics in and outside the world of oncology. We have an inspirational guest today, Pat.
If you ask anyone who's achieved any level of success and how they've achieved it, most likely they'll mention a number of people who've influenced them along the way. Quite often, these people reflect on their mentors. And after a certain time of accomplishment and reflection, they begin to mentor others. This is very much what our next guest has done. Hyman Muss has been a mentor to me and to Dave, and he's one of the most outstanding, wonderful people in the world, and we're so excited to have him today. Dr. Hyman Muss served in the U.S. Army in Vietnam, where he was awarded the Bronze Star Medal. He's an experienced clinician scientist, the Mary Jones Hudson Distinguished Professor of Geriatric Oncology at the University of North Carolina School of Medicine, and the Director of Geriatric Oncology Program at the UNC Lineberger Comprehensive Cancer Center Program. His interest in education and research focused on cancer in older patients, and he is internationally recognized in this area. He's been the co-chair of the Alliance Committee on the Cancer in Older Adults and won the B.J. Kennedy Award from ASCO in geriatric care. His particular interest and research expertise is in the care of breast cancer patients with a focus on the management of women who are of older ages. He's had a major interest in breast cancer survivorship and long-term toxicity of treatment, and also served as the co-chair of the Breast Committee for the Alliance Group. He serves as a mentor for medical students, medical residents, junior faculty, and more recently, his geriatric oncology fellows. He's served on the board of directors of the ASCO Foundation and on the ABIM, the American Board of Internal Medicine, where both Dave and I were privileged to work with him and witness his leadership and his deep breadth of knowledge. Dr. Muss, thanks for joining us today.
What a pleasure to be here. Thank you so much for inviting me. My mother would have loved the introduction.
Well, speaking of that, tell us a little bit. You grew up in Brooklyn, so tell us a little bit about your parents. Your father was a dentist, I think, and your uncle was a general practitioner. And so give us a little bit of the early life of Hyman Muss.
Yeah, so I grew up in Brooklyn, New York. I was born and bred there. I went to Brooklyn Technical High School. I almost went to Brooklyn College, but I came back and went to Downstate Medical Center, which was just terrific. My tuition was $600 a year, but that's another story. My parents lived in the same neighborhood. My dad was a dentist, so we knew all the people. My uncle was the GP. You came into their office, sat down, and they saw you anytime, day or night, almost 24/7. Something, we're probably not going back to. But they had profound influence on me. My uncle, as a GP, used to take me on house calls in Brooklyn when they were done. And he had an old Buick with MD plates, and I would go into these families, and they loved him, and they would give me ice cream and things. Maybe that's what made me a doctor. But it was a terrific and indelible experience. I had terrific parents. In those days, the doctors and medical people usually lived in the same neighborhoods as their patients. So they really knew their people well. It was a terrific upbringing. I got to love medicine, have never had to look back.
So your inspiration for a career in medicine obviously started at home. Tell us more about your formal education. You mentioned your high school education. What about college and shortly thereafter?
Yeah, well, I went to Lafayette College. I was not the best high school student, but I had good college board scores, or whatever they called them then. And I went to Lafayette, and I thought I was going to be a chemist, a chemistry major. But I took enough pre-med courses, and I spent a summer in a lab building cyclic ketones. And everybody was outside sitting on the lawn of the campus. And I was in there with all these distillation apparatus. And I said, I don't think I can do this the rest of my life. So I applied to medical school, and I got in several medical schools, but my father at that time was dying of metastatic bladder cancer. He had been a heavy smoker, and he was still working as a dentist. He worked until the day he unfortunately died. But I got into downstate. We lived in Brooklyn, and my uncle, the GP, said, hi, you need to come home and help take care of your dad. I'm an only child. So I did, and I had a wonderful experience at downstate. Several years ago, I was listening to NPR and heard that one of my professors had won the Nobel Prize, Dr. Furchtgott, in physiology. One would have never thought. And I had a wonderful education and subsequently got into what was then Peter Brent Brigham in Boston, did my internship and residency there, joined the Army in medical school, so I wasn't drafted. There was a program then. And then after first year of residency, went to Vietnam, worked with an artillery battalion, a mystical experience, but no regrets. And then subsequently came back and did hematology and oncology at Brigham and at what was then the Jimmy Fund and Sidney Farber Cancer Center. And Tom Fry had just come, and I did hematology with a guy named Bill Maloney in Boston at Harvard. I'll tell you, a wonderful man. He was like a surrogate father. My dad had died by then. And just feel I've had every opportunity to have a wonderful education and terrific mentors along the way.
So we want to ask you about both of those, gentlemen, but I would like to just, if I may, drop back to your experience in Vietnam. What was that like?
Well, I was 27 years old, and I was put as the doctor for 500 men in artillery. My job was to take care of the general health of the troops. Fortunately, we didn't have many casualties. It wasn't a front war like my uncle, who was the GP, actually was in World War II, landed at Normandy about a week later and went all through World War II as a doctor. But Vietnam was an unusual war. There wasn't really a front. So my experience was I would go out to fire bases, which were units of about 100 men in the jungle, go out 3 days in a week in a helicopter, do sick call, check people. I dealt with really alcohol problems, unfortunately, a lot of drug problems. You had young people with really not a lot to do during the day. You know, nothing much to do and no real goal of being there. I did that for a while. And actually, the reason I got the Bronze Star was because I set up, was nothing like standing in front of a machine gun. I'm not that kind of brave guy, but I set up a drug amnesty program. So I got a lot of support from our regular field people to do this. So we didn't have to keep sending kids home with dishonorable discharges. And I learned a lot. I think we're reasonably successful. I learned a lot about artillery. I think overall it was a great experience in my life.
Tell us how your interest in hematology and oncology originated. Where did that come from?
When I was an intern at the Brigham, Dr. Maloney was a very famous Harvard professor. He had studied war casualties after Hiroshima, was one of the people that found the Philadelphia chromosome and CML. He was a guy that rounded on every single one of his leukemia patients every day. So I was an intern. So in those days, I would go and see all the hematology people rounding because all the acute leukemia patients and all the serious cancer patients were right on the floors, right on the wards. We had 17-bed wards, and then we had some private rooms. And he loved what he did. And before I left for Vietnam, we didn't have Aracy adenomycin. So every leukemia patient I saw died. This is 68 to 70. Yet we tried all these different regimens. Occasionally you got someone who did well for 6 months, a year. But his bedside manner was absolutely wonderful to me. He knew all the patients. He'd ask them about where they lived in Boston. His humanism was terrific. And yet I loved the diseases he treated. The stakes were high. We didn't have good treatment. And I decided that that's probably what I want to do. So when I was in Vietnam, I applied and got back in the hematology fellowship and came back and did that. I saw Aracy and adenomycin. I gave the chemotherapy then. And he'd say, go up and treat Harry Smith with Aracy and Dronamycin. I had the syringes in my pocket, guys. Forget about hoods and mixing. And I'd go up and treat them, and the marrow would be gone within 4 or 5 days. I did a bone marrows. They published their regimen in the New England Journal called COD, C-O-D, because they also gave vincristine. So it was cytarabine, vincristine, and Dronamycin, the COD regimen. It fit Boston. And I saw it was like the emergence of cisplatin after Larry Einhorn, right? You saw people that never survived going into remission. And I saw some remissions in AML, and it cemented it. About my second year of residency, we had a child. I was running out of money. I was being paid $6,000 a year, and I had the GI Bill. I went into Dr. Maloney, and he talked with Dr. Franny Moore, who was head of surgery at the Brigham, and they made me the Sidney Farber Research Fellow, doubled my salary, and I had to go to the Jimmy Fund and see cancer patients. And it so happened that was when Tom Fry came to Dana-Farber. And so I started rounding with Dr. Fry and seeing those patients. And I think the first day I walked in, I knew I wanted to do more than just leukemia, because I saw groups of patients with every disease. We treated everybody with CMFEP. It didn't matter what cancer they had. And I just loved it and said, my God, there's so much we can learn. What a great career. And so that got me into the oncology portion. And then I was offered to stay at Harvard. They were going to make me an assistant professor, but they wanted me to do lab work. And I knew my personality. I just wasn't for me. I worked with a lovely guy named Frank Bunn, one of the world's great heme guys, in his lab. And he's still a close friend in his 80s. And he told me one day, he said, hi, I don't think the lab is for you. And he actually helped me get my first job at Wake Forest University, which turned out to be wonderful. So that's how I ended up my circuitous in Hem-Onc. And it's really from great mentors. It's from Bill Maloney. It's from Tom Fry, Dave Rosenthal, tons of wonderful people along the way that not only taught me a lot, but they seem to love what they do, which is a gift in life, to love what you do and love the people you're doing it with. They instill that in me.
From there, you went to Wake Forest, and there's a couple colleagues down there, I believe, that inspired you, Charlie Spur and Bill Hazard, who was a founding father of geriatrics. Tell us a little bit about that experience and how that shaped your life.
I was looking for a clinical job, and I looked at Rochester, and I got snowed in one night in Wake Forest. And I said, where's the contract? And I signed it. And my mother, who was living in New York City, didn't know where North Carolina was. My mother was from a family, was born over a candy store in Greenwich Village. And she said, where are you going? And then I showed her where it was. And she says, they're going to kill you down there. And it turned out to be one of the best decisions of my life. My wife, Loretta, who both of you know so well, we got out of our VW with our dog and our daughter when we moved here. And VW bug, by the way, not a van. And she cried. It turned out it was one of the best opportunities of Charlie Spur was an iconic oncology leader. He actually did some of the early work on nitrogen mustard in Chicago during the war, the first chemotherapy drugs. He was a terrific leader. He had patients programmed in on those IBM punch cards. He had little cards with the protocols, CMFEP, CMF, AC, on little laminated index cards. I learned so much from him. And he was, to me, great leaders and great mentors, more from things they do themselves to teaching other people, and whose brains have the ability of having the same dopamine shot when you see one of your fellows or young faculty present a wonderful study as you do. And your brain isn't saying, I wish I was up there. It's saying, isn't this so cool that this young man or woman or fellow or medical student is doing such a wonderful job? And I had something to do with providing the soil for this seed to grow. That's the kind of guy he was. And so it was wonderful there. And as I moved on, we got a new chief of medicine, Bill Hazard. And I still hear from Bill on rare occasion, but Bill was one of the first geriatricians in the United States. He wrote the textbook, and his wish was that all the faculty and all the specialties get involved in a geriatric project. And so I had all those little index cards and I looked and saw how many older people with breast cancer, metastatic breast cancer, we'd given chemotherapy to. And these were little protocols, nothing like the protocols today. No 50-page consent forms, 50 pages of where your data is stored. They were like, here's the treatment, here's the dose mods. And I looked at those 70 patients with one of our residents, Kathy Chrisman, who she may be retired now, but in any event, we wrote a paper and showed the old people did as well as the young with breast cancer. And we published it in JAMA. And it's one of the few papers in my career I got no review. They accepted the paper. I got no reviewers. So because I'm from Brooklyn and my English is not what it should be, I had to have my friends read it to just make sure I didn't say anything egregious. But it got published. And the next thing I know, my friends in medical oncology in the state were calling me. They said, I got a 75-year-old woman here. And I'm saying, guys, I just wrote this paper. I really don't know anything about older people. But slowly with Bill Hazard and others, I got more and more interested. I started reading about geriatrics, and I ended up making it a focal point of my career. It was kind of happenstance. And Bill was a wonderful mentor. And then as I subsequently moved on, I worked with terrific people like Harvey Cohen and Lodovico Balducci and Martine Exterman, all of them heavily involved with ASCO over the years as well. And BJ Kennedy, they were wonderful to work with. And BJ was inspirational because BJ would get up at an ASCO meeting and he'd say, when he saw the age cutoff, he'd say, how come you didn't let old people on that study? There'd be 1,000 people in the audience. And so he really was a great mentor. And I had the bittersweet opportunity of writing his obit for JCO years ago and kept up with his family a few years, but he was a wonderful man.
I'm just reflecting on the fact that today patient registries are sort of mainstream, but certainly in the 70s, 80s, and even into the 90s, having a list of patients with a particular disorder seemed almost novel in many respects. And to have that was a godsend.
It was a godsend. I still remember those little file cards, and he called it the Oncology Research Center, and it was a godsend. And got to remember, this is like 74, 75. It's a long time ago.
So many of our listeners may not be as familiar with Wake Forest as they are with Duke and North Carolina, the other medical schools located there. But you were at Wake at a point where, it was one of the top oncology programs in the country at that time. Still is. I don't mean to diminish it, but there was a who's who of people there at the time. And you were also involved in creating, I think, one of the first cooperative groups of sorts.
Right.
Tell us, it was a Piedmont Oncology group. Tell us about that.
Oh, yeah. Well, that brings back memories. So the NCI at that time wanted to get more, I think, rural and other smaller places involved in research. And they put out an RFA to form like regional cooperative groups. And we formed the Piedmont Oncology Association, the POA. We actually did well for a few years. We wrote some really good studies. We got 1 or 2 New England Journal articles. I worked with all the people, mainly in the community docs who would go on, put people on protocol. I looked at all the x-rays and scans in a lot of these patients myself as part of the studies we did. And it turned out to be a wonderful organization. And it's still run today by Baird Powell, who's one of our terrific fellows, who's the head of oncology at Wake Forest. But after a while, we just couldn't compete with CALGB, of which I was a member of also, and ECOG and SWOG. Even North Central Group, which was kind of formed in a similar venue, eventually merged. So we did a wonderful job for a while, but the truth is we just didn't have the manpower to write studies for every disease site. So eventually we kind of petered out as a clinical trials group. But it's been maintained for educational programs, and it's really served as a good resource for a lot of good education for the community oncologists, who give most of the care in this country, in the state. So it's been a good, I think Pat kind of exceeded us with the HOG, with the Hoosier Oncology Group, which was in a similar vein, but it was a great experience. And it was all Dr. Spur who thought of doing this and built it.
Certainly was inspirational in many people in and outside of Wake Forest. So with such an idyllic life, what in the world possessed you to move north to Vermont?
Well, you get this urge in life. You want to be a leader. You want to be a chief. Now I tell younger people, if they love what they do, don't do it. So I got a wonderful opportunity at University of Vermont to go up there and be head of Hem-Onc. Chief of medicine was a terrific guy, Bert Sobel. The university at that time, at one time, it had a wonderful oncology program. It had a federally funded cancer center with Irv Krakoff and Jerry Yates, two other iconic guys. I don't know what the politics were, but it had lost a tremendous amount of faculty, especially its clinical faculty, and they needed to rebuild it. And I went up, and I thought, well, I'm in my 50s. This is going to be a great opportunity. If I don't do it now, I may never get the chance. So I went up there, and actually it was a great opportunity. We hired terrific people. We got in CALGB and we participated. We had actually a very good accrual for a small place, and we had a very small but very effective cancer center. So it turned out to be a really good experience. I worked with wonderful people. I recruited some wonderful people. But over time, the issues of the business of medicine, all the issues that happened, I'm saying I'm kind of losing my focus on clinical care and clinical trials, which I love to do. I don't need to tell either of you. I mean, Dave, you've been chief and department chair, and Pat has run cancer centers. After a while, the administrative tasks just were so overwhelming, and I didn't enjoy them. Then I said, I've got to get back in some type of more clinical focus. And that's when I decided to look around and fortunately found what's turned out to be a dream job at UNC. But it was a, time of life. Maybe my ego got in the way of my logic. I don't regret it. I met, and I think we rebuilt a wonderful clinical program, but you realize some of the resources of big places we never had the research infrastructure to hire a lot of people and get, big programs going on and great translational programs. Just didn't have the funding, but it was great. And I have no regrets. And I learned how to tolerate the cold weather. And I have a lovely daughter, Sarah, who still lives up there. So we get back occasionally. And I've kept up with a lot of the people. There's some wonderful people at UVM.
From there, though, you were pulled down to North Carolina, where you've, again, built an incredible, the breast program there is outstanding, but you created a geriatric oncology program and one of the first geriatric fellowships in oncology in the country. So tell us a little bit about that and what you feel maybe your legacy is there at North Carolina.
Well, I had the opportunity over the years when I was at Wake, really, I got to know Shelley Earp, who's our cancer center director. I think maybe you were close to him, Pat, the longest surviving cancer center director on the planet, or among them. And we were good friends. And North Carolina's legislature actually gave the University of North Carolina substantial funding to improve cancer care in North Carolina, not just research. And so I had talked with Shelley about maybe moving. And because of the generosity of the state, really, he was able to really get me going, start a geriatric oncology program. And what I wanted to do was develop trials. As Dave says, I built a registry in 2009 here for older cancer patients using geriatric assessment. I have 2,000 patients, which has been a resource for all types of faculty and fellows and students to write papers. But I was able, with the support, to do things like this right from the get-go. So it came, and plus I joined probably one of the best breast groups on the planet with Lisa Carey and Chuck Peru and Larry, terrific people. Claire Dees. I had a great luck in doing this. So I was able to really focus, get great support from my colleagues to build studies focusing on older people. And then I had the great fortune of meeting Ned Sharpless, our prior NCI director. And Ned is one of the world's great aging biologists. And I don't mean aging as an adjective. He's really been a master on why we age, the biology of aging, cell senescence. So Ned taught me all about cell senescence and the mechanisms, especially the gene expression P16, which is our own CDK inhibitor. And so I was able to start using his lab, collect samples, treat people with chemotherapy, follow them off with geriatric assessment. It was a great opportunity to do that here. And we got a lot of studies going. And we showed what the pediatricians have known for years, that chemotherapy dramatically ages people, not just children, but adults. But it also allowed me to work with my colleagues in lymphoma and lung cancer, to do little studies along the way. And we eventually then built a T32 program. We got a T32, which we're kind of completing now our first 5 years to train oncology specialists in geriatrics. So the way we do it is they can be surgical oncologists, GU. We had a GYN oncologist, medical. With their hem-onc training, they do a year where they work with the geriatricians. So they go on geriatric inpatient service for a month, and they really learn about older people. And part of it's a project. So we've been able to build that and develop a lot of programs with that. And I should say we've been very successful with mentorship and with ASCO support for things like YIAs for the late and great Arthi Haria, who absolutely an amazing woman. Some of her legacy at ASCO, the YIAs and things we have, we've been successful in applying for some. So we've been able to build a whole spectrum of med and hematologists. We have an interest in myeloma and AML, focusing on older people. We've been able to build a whole team approach, including translational projects related to older people. And it's just been a great opportunity. And hopefully my legacy here will be to, and I'm working on it. We have a wonderful guy, Bill Wood, who is very effective and has built this incredible coaching program to continue this legacy. Like many of us in this field, we are bothered because we all know the stats. We all know that first slide of the demographics of cancer. And yet it's been very hard in our culture to provide a lot of the services and build the clinical trials we need to best care for older people. It's still a major problem in this country. So as I cut back on my clinical care, I'm going to still advocate to try to improve the care of older people. Do geriatric assessment, build it into your clinical programs, get your hospitals to support you, convince them, build business plans, etc. And hopefully that'll be my ultimate legacy, that we've made greater awareness of the older people other than the usual stats. And we're really trying to care for them in a much more global sense, in a much more holistic sense than we've done. I hope we'll be successful. It's a slow haul, but we've got lots of great young people coming up through the pipelines. ASCO has been a great player in this. Many of you know people like Supriya Mohili and William Dale, Heidi Kleppen, people, the next generation that's going to keep building this. So I hope the legacy will be that we get more buy-in, more interest, more trained people in other oncology-related subspecialties, rad-onc, surg-onc, that will really focus on the care of older people.
I don't think there's any doubt that that'll be a part of your legacy, Hy, but I think your legacy will be much broader than the world of geriatric oncology. Your mentorship, leadership, your clinical skills, your educational capabilities, all of that will certainly last for many, many years in the future. Well, I don't want to bring up a touchy topic, but you yourself are geriatric, and we're wondering what your plans are for your semi-retirement. I recognize you're not retiring, but what do you like to do outside of medicine?
I'll tell everybody who's interested in hearing this, on Tuesday, I had my 80th birthday.
Oh, congratulations.
And I think I'm one of the most blessed guys. I'm pretty healthy. I married up. My wife, Loretta, who both of you know well.
Yeah, you definitely married up.
Yes, it's really carried me most of my life. She's great. And so she flew up our 3 kids and we celebrated. And I'm very fortunate. I have the enthusiasm and strength to do more clinical medicine, but I think the time has come for me to cut back my clinical medicine. So I'm going to do that in June. The hardest thing I've done is say goodbye to so many of my patients here. So that's our plans. We've been blessed. We have a lovely family. We're pretty close. I'm never bored. Probably you and know well, I love to do things like fishing, outdoor stuff. I've really gotten into woodworking. So I'm not going to be bored, but there will be a small piece out of me when I walk out of that clinic in June. I know that. And my 2 close psychiatry friends think it's going to really be a hard fall, but I don't think so. I still have some grants. In fact, I'm working with a fella in City of Hope, Mina Sedrak, who's been very involved in ASCO too. We are hoping to get an R01 looking at senolytic drugs, that may prevent aging and exercise in women with breast cancer to see if we can reverse the trends of chemo. So my brain is still on that stuff, but the clinical care is going to be tough. I think I had a note, and for some reason, we talked about so many things. I wanted to mention that one of my great opportunities was joining the CALGB and then the Alliance and getting the support of Dr. Shilsky, Rich Shilsky, who's been, one of the icons of ASCO, to build a cancer in the elderly working group with Dr. Harvey Cohen at Duke. And Harvey is one of the world's great geriatricians. And using that to get studies done, to incorporate studies with Arti Huria on geriatric assessment, and really have it as a place where a lot of younger investigators could get started on a career in geriatric oncology. And that was really a great opportunity. Was kept on by Dr. Bertagnoli, who, now is our NCI director. And I think was really the first group to really give good support for this.
So we want to thank you very much for being our guest today. We also want to thank our listeners of Oncology, etc. This is an ASCO educational podcast where we talk about oncology, medicine, and much more. So if any of our listeners have an idea or a guest they would like for us to interview, please email us at education@asco.org. To stay up to date with the latest episodes and explore other educational content, visit ASCO's website, education.asco.org. Thanks again for being our guest, Ty.
My pleasure. Thank you so much.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.